starting out at the Doghouse of Safety Harbor in Safety Harbor, Florida. I'm Dr. Cherie Buisson, and I'm going to talk to you today about elderly pet care. I am a hospice veterinarian, so I am taking the International Association for Animal Hospice and Palliative Care's hospice certification course. This is the first hospice certification course that's ever been offered, and it's also, this is the first graduating class. So I'm teaching that course, and I'm also taking it. So in October, I will be one of the first hospice, or in the group of the first hospice veterinarians that are certified in the world. And if I remember correctly, I will be the only one in the state of Florida. So that's really exciting. I love hospice care. I do house calls, and that's what I want to talk to you a little bit about today. So this is information about me. You are welcome to call me, email me, text me anytime. I love hearing from people. I love talking to you about your elderly pets. All my consultations by phone are free. So if you want to call and talk to me, or you want to email me and just get a little bit of information, I'm happy to talk to you. It's no problem. I can't give you specific advice about your pet unless I've examined it. That's the law. So, but I can talk to you a little bit, and I can also talk to your veterinarian if your veterinarian has questions or concerns. So let's get rolling. I'll tell you a little bit about me. That's always the hardest part of any presentation for me, is to tell you about me. I'd much rather tell you about hospice care. This is me and my little dog, Muggle. Muggle was 15 years old when he passed last February from cognitive dysfunction, which is basically doggy Alzheimer's. We're going to talk about that a little later in the presentation. He was kind of my inspiration for all of this, because dealing with cognitive dysfunction in a dog was just miserable. And I'm a veterinarian. I know how to do this. I guide other people how to go through it. But until you go through it yourself, you can't possibly understand how difficult it is and how hard the decision-making process is. So we'll talk more about my mug man a little later. A little bit about my services. So I service Pinellas and the surrounding counties. Again, I do free phone and email consults, and then I come to your home. And that has a lot of benefits as opposed to bringing your pet to the vet's office. I work in vets' offices too, so I love veterinarians. I love working with them. But especially if you have, let's say, a big dog with arthritis, getting them in the car sometimes is the worst part of the whole thing. And then not only that, but then they're lame and uncomfortable for days afterwards while they recover. So I see a lot of big dogs in practice, and it's specifically because they're just hard to move around, and it's uncomfortable for them. So I do house call hospice care, and when I say hospice, there's two things that we do. We do hospice care and palliative care. So let's say you have a large breed dog with severe arthritis. That dog isn't necessarily going to pass away from arthritis imminently. It's something that over time is going to happen. And so if that dog is hard to move, I can come to your home, I can evaluate your home, because a lot of times there's just slippery surfaces that need to be dealt with, or there's specific things that we can move around or change in order to make them more comfortable. And certainly I can't tell any of that if I'm not in your house. You could take video for me and you can describe things, but it's much better if I can see their environment. The second thing is that your pet doesn't know to be worried about me, because this is how I show up at your house. I never wear scrubs, I never wear a lab coat, because I want your pet to think I'm the cool stranger with the treats and not the scary doctor. So that has its challenges, because, you know, to do an exam, once they figure out that I'm not there just to give them treats, some of them are a little suspicious. And certainly it's better if I can examine your pet and they're cooperative, which most of my patients are. But even if they're not, I'm really big on bribes and treats. So if you can save their favorite foods and maybe have them a little hungry when I arrive, it's amazing what I can get done just by you putting food in their face and making sure that they're paying attention to you and not to me. So I come and do a physical exam. I take a really lengthy history. So my appointments, unlike 15 or 20 minutes at the vet's office or 30 minutes, I'm usually there with you for 1 to 3 hours, depending on how ill your pet is. If they just have arthritis, that's usually a shorter visit. You know, if we're dealing with cancer, that might take a little bit longer. And so we talk about, instead of talking about how to cure things, I talk about how we can make them more comfortable. So we're not getting to the bottom of what's wrong with them and fixing it. In most cases we can't, but I can come and talk about, okay, well, I'm seeing that he's limping and that he's not eating very well. So we're going to address nausea and pain and see if that makes them eat better. Because sometimes, let's say you have a dog who's painful in the neck, they're not eating because they can't bend down to pick up the food. And if we just lift the food dishes, they can put their head right in it. So those are the kind of things that while I'm watching your pet in the house, and I'll probably have you take them and walk them over to the food dish and see how they react to it, gives me a great idea of what's going on. I also do euthanasia at home, which I love doing for people because, one, you have all the privacy you need. If you need to fall apart, it's much easier to fall apart at home in your PJs than it is to fall apart at the vet's office. And I also love it because it gives the housemates a chance to say goodbye. We all know when we lose a pet, if we take the pet away and never bring them home, their housemates look for them. It happens with people too. If people pass away outside the home, the pets wait for them to come home because that's all they know how to do. So it gives you some privacy. It gives the housemates a chance to say goodbye. And we take as much time as you need. I typically allot an hour to be at your home. If you want things to go quickly and boot me out, I totally understand. If we want to take our time, we can do that as well. And then I also provide cremation, and I use Pet Angel down in Pinellas Park. I absolutely love them. They have been very reliable. They let me just walk into their facility and look around anytime I want, and I have utmost faith in them. So that's who I use. But certainly if you want to make other arrangements, I can help you with that as well. So we talked about this a little bit. My main thing that I look for in these patients is pain, because I hear all the time, oh, he's not painful, he doesn't cry. And animals don't tend to cry when they hurt unless it's really bad. I've had animals with broken legs and they're walking on them, so evaluating it by crying is missing a lot of stuff. And one of the things that I kind of equate it to, I'm 42, so I'm not that old, but I get out of bed pretty much every morning and something hurts. I'm like, oh, my neck, or oh, my low back, and you're stiff and sore. And I may not say a word about it. I may be in quite a bit of pain and not do anything. I'll be at your house working on your pets. I'm driving around town. I'm shopping. I'm doing what I need to do. But that pain is still there. But I can tell my doctor, hey, it hurts. They can't tell us unless they show us, unless we do a really thorough physical exam and check it out. But we're going to talk about some things that you can look for at home that might clue you in that they're painful. So I do symptomatic care. So again, we're not, I do run lab tests, for instance, for my dogs with arthritis that are going to be long-term. If you want to run blood work to keep an eye on their liver, if we have them on certain drugs that might affect their liver, I'm happy to do that. But with hospice care, we're worried about quality of life and not necessarily quantity. We may get less time with them based on the medications used, but it will be good quality time where they're comfortable. And that's what's most important. I prescribe medications. I'm a big fan of supplements. I do a lot of supplementing. I don't use supplements that don't have some science behind them. There's so much out there. I mean, you can go onto Amazon and type dog joint supplement. You'll get 10,000 hits. I use things that have scientific papers that show that they work and that the company will let me call and find out exactly what's in them. There are some companies with supplements where I have a patient who's allergic to chicken. And I call and they say, well, it's a secret what's in our stuff, so we can't tell you. Well, that doesn't help me if my patient's going to break out in hives eating it. So I only use things that are as proven as possible, and that eliminates a lot of the stuff that you find. And these are things that I also have a lot of experience with and I've seen animals respond to, which is helpful. We do devices, so the big dogs, there's the help 'em up harness. I don't know if you guys have heard about that, but there are lots of devices. I had someone yesterday, as a matter of fact, who had I think it was called a get up and go or an up and go harness, just to help get their dog on their feet. My husband's a chiropractor, so I have a little bit of concern too about clients leaning over and picking up 80-pound dogs. So that's good for both the client and the patient. So it improves both of your quality of life. And that's also why I'm there, to make sure that not just your pet is feeling okay, but that you're doing okay. Because care at the end of life is hard. There's a lot to do. And if you're losing sleep, if you're up all night and you're having trouble working, those are all things I want to address. And so I always ask about how things are going at home and how everybody's feeling about this. So we make sure the whole family as a unit is being taken care of, not just your pet. And then I send a report to your veterinarian, if you have one, just like any other specialist. If your dog goes for surgery, the surgeon sends notes. So I send a very detailed history, a very detailed physical exam, and then the discharge instructions that I email to you in writing also go to your veterinarian so they know exactly what I've told you. And that just keeps the communication open between all of us. And if you decide you want to go to your veterinarian's office, to get your pet vaccinated or get their heartworm prevention or their flea control, we work together. So this isn't an either or that you have to pick me and you don't get to go back to your vet. I love it best when I can work with your veterinarian, and I have several veterinary offices in town who refer to me and then I refer back to them, and it works out great because then you're getting lots of eyeballs on your pet so that we can all make them as comfortable as possible. And we talked a little bit about this with why I like to do in-home euthanasia as opposed to anywhere else. I will say that I also do euthanasia. There's a park right by my house that has a really nice spot by the lake, and some people don't want to have their pets pass at home, whether it's because there's disruption there, you're having construction or something done, or you just aren't comfortable with the idea of them passing in the house. I do have people that come out to the park and meet me there. It's also less expensive than me driving out to your house, and we do the euthanasia out by the lake. It's absolutely beautiful out there, and I do that with dogs. I also have done it with cats, and we just sedate them in the car so they can't get away from us. The dogs usually think they're in hog heaven already because they've got all these good smells and cool stuff, and there's ducks and other birds. So we have lots of options for what we can do. Similarly, if you want to go to a spot at a certain beach or you want to go to a family member's backyard, you let me know. I'm pretty much game to go anywhere as long as everybody's going to be safe. I know, having put my own dog to sleep at home, I want to be able to just fall apart as much as I need to and cry as hard as I want to and not have to drive home. I hate seeing someone walk out of my office with an empty carrier or an empty leash. It just breaks my heart. I would rather that we do what we have to do, and I take your pet with me, and then you can crawl right into bed if that's what you need to do, and just cry for the rest of the day if that's what you need. So I like doing it at home for those reasons. We're not in a rush, and typically there's no other animals around or other people that are going to disrupt. There's not phones ringing typically, that kind of thing. I like it to be quiet. You can light candles, you can play music. I've had people play, have Jerry Springer on the TV because the dog is used to watching Jerry Springer, and that's what we're going to watch. Whatever makes you happy. One of my favorite home visits, the client actually put on a Harry Potter movie. Because the dog would sit and watch Harry Potter marathons with them. And so they asked for some privacy, and they sent my assistant and I into the living room, and we got to watch Harry Potter while we waited, which was really cool. And they just took their time and watched their movie, and it was great. So you can set it up however you want to. You can invite, that's the other thing too, you can invite anybody you want to. If your parents or friends or siblings, grown kids want to come, there's room, and everybody can be there. I talked to you a little bit about the housemates and how important it is to let them say goodbye. These are patients of mine. This little cat was, I think, 22 years old. I see a lot of very, very elderly pets. And this little dog was about 3, I think. And the cat absolutely could not stand this dog. Every time the dog came near her, she'd smack her in the mouth. So this was after we had put the kitty to sleep. I went to pick up the basket, and the dog started crying. So I put the basket back down, and she walked over and started licking the cat's paws. And I thought, oh, how sweet, they were friends. And her mom goes, no, they weren't friends. She used to smack her all the time, and she really just wants to, sniff and touch her paws. So that wasn't nearly as sweet as I thought it would be. But it was great because she decided I wasn't allowed to leave until she was done. So I put the basket back down, and she had her time. And it was, she was a hyper little dog, and then she just stepped back and sat, and then she let me take the basket without any other words or anything. So that's part of what I love. Even pets that don't particularly like each other are sometimes in need of saying goodbye and having some closure. Okay. And this is just a little bit, I respond, I do text, email, and phone. A lot of people can't talk to me. You're on the phone, you're upset. So I will tell people, stop talking, I can't understand you, text me or email me, and we can talk that way. And that's really great because if I'm doing hospice care for your pet, or if you have me kind of on call for euthanasia, you can text and say, hey, you know what, things aren't going so great. And then I can text you back, here's my schedule for the week, where, let me know where you want me to hold a spot for you. And so we can stay in touch more easily without having to do, phone calls. We certainly can, and I'm happy to talk to you for as long as you need to, but sometimes something quick is easier on both of us. I do see appointments in the evenings and on weekends. I'm not always available during those times, and certainly with a little bit of notice, I have a better chance of getting to you. I also answer my phone pretty much anytime I'm not awake. So if I don't answer, I'm either talking to somebody else or I can't get to it right then, but I always call you back. And I pretty much have my phone off from about 9 p.m. until about 6 a.m. So you have pretty good access to me. I do a lot of grief companioning. I'm certainly not a licensed mental health professional. I have several I can refer you to, but sometimes you just need to talk your way through it, and I'm happy to do that too. I'm there for you if you need to talk. And plenty of times I'm available with just a few hours notice. There was a call the other day and I was at the client's house in an hour and a half, and they were pretty far away from me. So the more that you talk to me, the more that you stay in touch, the better off we are. These are some pictures from the park near my house where we sometimes do the euthanasia. This is the actual spot where I do them. And it's a private spot. I spend a lot of time walking in that park, so I've picked a spot that's kind of private. It's right by the lake, and we can have some privacy and also get to see something beautiful while our pets pass. So that's it for the all about helping hands. This is the portion about helping your pets live better, which I know is why you're here. This is me with Rowdy. This is a dog I met up in North Dakota. We were on vacation visiting friends, and this dog was, I don't know how old he was, I want to say 10 or 11, and he went everywhere with the family. So they took us for a ride out on the boat on the lake, and Rowdy just jumped up on the seat and laid in my lap. And that's the kind of thing I want you to be able to do with your pets. And so if we treat their arthritis pain or we treat their symptoms, we may get more quality moments like this where they're laying on their back all happy, as opposed to, they don't get up, you have to help them to get outside. It doesn't have to be that way. And even dogs and cats that are fairly far along in arthritis, it's amazing to me how often just the right medication can help them and really make them feel better. So definitely something to keep in mind. And if I've heard it once, I've heard it a million times that if they're not painful, or if they're not crying, they're not painful, and that's just not true. The number of times that I've seen painful pets that actually cry are pretty small. Most of the time, they do things like hide. They limp. I've had a lot of people that will come into the office and say, or I'll be at their house and they'll go, "Well, he limps, but he's not painful." Do you limp when you're not painful? Maybe if you have an old broken leg that didn't heal right, but again, that probably hurts too. So if they are lame, if they are leaning to one side, or they don't want to move in a way that seems natural and normal, then they're probably painful. And when in doubt, treat them for pain. If nothing happens, then they probably weren't painful. But I would much rather treat them and make sure that that's not an issue and give them a good quality of life than just assume that they're not hurting. This is a big one. Do you guys have cats? Mm-hmm. No. Oh, okay. All right. A few of us have cats. So one of the main symptoms, one of the first symptoms of arthritis in cats is jumping less high or jumping less often. So the cat that maybe used to jump straight up onto the counter now jumps onto the chair and then onto the counter. Or they've stopped jumping at all. My dad had a 17-year-old cat that hadn't been jumping for a long time, and it wasn't something we talked about, so I hadn't noticed. And I said, aren't you worried about putting that on the counter? Ollie might get it. And he said, oh, Ollie hasn't jumped up on the counter in years. And I said, well, why didn't you tell me? So I got him, I don't know if any of you are familiar with Adequan. It's an injectable joint supplement. Best stuff ever. We started him on Adequan, and by the third injection, which is just the buildup, he was jumping up on the counter again, for which I got in trouble. So, yeah, I know. It's like, be grateful. He's jumping on the counter. And my dad's like, I hate that he's jumping on the counter. But something that simple took him from too painful to jump to totally able to jump at 17 years old. And that applies to dogs too. They used to jump on the bed. Now they can jump on the couch, or they need help getting onto the bed, or in getting into the car. Those things are signals that there's some pain going on. Hesitation before jumping, or jumping and missing. So sometimes that's a visual thing. They go to jump and they don't notice where the edge of the bed is, and they fall down. But a lot of times they go to jump and it hurts and they don't get the push they need to get up there, and they'll fall, which just makes the pain worse. So if they hesitate and think about it before they jump, that's a warning sign as well. Shorter walks, or they used to kind of trot and now they walk slowly. Any kind of a change, and people will say, oh, well, he's just getting old. And that's partially true, but again, you know, a 17-year-old cat can still jump on the counter with the right help. So we want to make sure that we're not missing all of these signs of pain and potentially cutting our pets' lives short, because we all know, especially with big dogs, arthritis can be a killer. It doesn't kill them directly, but one day they can't get up and then we have no other choices. So we want to make sure that we catch this as early as possible to give them a long and healthy life. Less playing, and so you know how dogs do the grab and shake with their toys. If their neck or their back is hurting, they might not do that so much, or they might do the shake and then fall over or stumble. So that's another sign of pain. Also, when they're painful, they will often not use their limbs the way they should, and they start to lose muscle. So we start seeing the bones through their skin. You know, we can kind of see that their legs are shrinking. They might wobble when they walk because their muscles just aren't strong enough. And things like swimming, doing controlled walks, range of motion where we just kind of gently massage and move their legs, bend their joints, can really help them a lot. Sleeping in unusual places, that may be because they can't jump into their normal spot, or because that spot on the floor that they used to love is a little too hard on their joints and so they can't lay there anymore. Not wanting to be touched or picked up, that's a biggie too. My mom's 17-year-old dachshund got to a point where if you tried to pick him up, he'd growl. And we just thought he was getting old and cantankerous, but looking back on it now, I mean, this was when I was a teenager, he was probably painful. I mean, he's a dachshund, so back pain is a thing that they do. So if they don't want to be touched or picked up, or especially if they yelp when you try to pick them up or growl, big red flag for pain. But again, crying is pretty rare. We just don't see a lot of that. And if that's what you're waiting for, you're liable to never see it. And we can really extend the amount of time that you have with them if we address these things early. In kitties, they did a study where they looked at cats and they did x-rays of their joints. And they found that by the age of 12, about 90% of them have arthritis in at least one joint. So if you have arthritis in a joint, it's uncomfortable. It may not be completely debilitating. I mean, I've got cats that I know are riddled with arthritis that still jump. But by the time they're 12, we really need to be thinking about that and thinking that we might need to step in and do something. And I often will just start with joint supplements, you know, something that's easy, if they'll eat it, or the Adequan. I'm always amazed how cats will allow people to give them injections way before they'll allow you to poke a pill down their throat. So that's an option as well. You know, we have powders, we have little treats, there's capsules, there's all kinds of options for good joint supplements. And that's a great way to lubricate their joints and keep them healthy. But we want to use what we call multimodal pain therapy. I see a lot of patients at the end of their lives and they're riddled with arthritis and they're on one pain medication. And it's not even a great pain medication. I like to approach pain from all different sources. So, you know, we have inflammation in their joints, the cartilage is being destroyed. We might have pain in an organ from cancer. We might have nerve pain from chronic back pain or arthritis. And mental pain too. You know, a lot of these dogs, like the Labs and the Goldens, that like to chase a ball and run, it's really hard for them to accept that they can't get up and do that anymore. And so, again, we treat the pain and see if we can get them back up and running. And if not, then we need to modify our play so that they can still get that enrichment. And you know, even if it means you roll the ball to them and teach them to roll it back to you so they can feel like they're still playing ball. I had a patient, my longest standing hospice patient, passed away this month, and we were a few weeks short of a year that I had been helping him with arthritis. And his mom just would throw the ball to him and he'd catch it. So he couldn't chase after it or run, but he gets so excited, even right up until the end. He was just barking and fussing for us to throw a ball to him. So that's terrific. We want to make sure that we enrich them however we can, and we don't let them kind of sit in a corner and rot because they can't do anything anymore. They can still do things, just maybe not the same way that they used to. So I usually start off with a joint supplement, if they can tolerate it, and a non-steroidal anti-inflammatory, an NSAID. And the NSAIDs for animals are specially designed for animals. So over-the-counter things like Advil can be dangerous and toxic to animals. So you should never, ever give that without talking to your veterinarian first. You know, we've unfortunately had pets die from owners giving them their medication, and they're just trying to help. But dogs and cats are not little people, so we need to be really careful. You know, a dose of Tylenol that a child could take will absolutely kill a cat. One dose, that's all it takes. So we need to be really careful with what we're trying to do at home. And your veterinarian is really the best person to tell you what things can be used together, and to use multiple different drugs to help attack pain on different levels. So I like to use the joint supplements, the NSAIDs. There's a medication called gabapentin that is good for chronic pain. It basically, I mean, we all know if we have chronic pain that the more that goes on, the worse it gets. And I went to a lecture and the professor said, well, with pain, the worse it is, the worse it gets, the worse it gets. And that sounds really simplistic, but basically that feedback constantly on the spinal cord telling you you're in pain, the spinal cord gets overreactive. And so things that might not normally be painful, like brushing your arm, suddenly are super painful. And gabapentin is one of the drugs that helps quiet that down. So I have about 6 or 7 different drugs that I kind of use in combination, depending on the patient and what they can tolerate. And those together really do help. And we try a few at a time, and then we add things or subtract things depending on how the patient reacts. And I'm constantly in touch with you about this. You know, how are things going? What is he on? You know, well, he didn't like the joint supplement, he stopped eating it. Okay, well, let's get him a new one. You know, and we try to keep all of those things together so that we're treating them as best we can. And if they're having anxiety because they can't get up and down, a lot of them are really anxious at night. Everything is worse at night. Your histamine levels go up and your cortisol levels go down, so your body is in a state of inflammation at night. You know, that's why you never hear somebody say, I was up all day vomiting. No, you were up all night because that's when you're the weakest, and that's when you're going to be attacked by your body, basically, when you're trying to rest and when you most need to heal. So we can also address mental pain with medications or supplements. There's things like Feel Away spray for cats, and Adaptil for dogs that we can spray to make them feel more comfortable just using, I mean, it's not aromatherapy, but it's similar, just to give them a sense of well-being and comfort. So this video is really hard to see, but I love it. I saw a client, we thought we were going to euthanize his dog, and I said, you know, it sounds like he had jumped up during a thunderstorm and hurt himself. I said, it sounds like he may have just bumped something, and maybe with some medication we can make him feel better. So I did a very aggressive pain protocol for him. When I saw him, he wouldn't walk. He just kind of stood, and he was really tense. His tail was hanging straight down. He couldn't move at all. And that he was one where when we lifted him, he cried. I mean, he was in a lot of pain. So 2 days after I started his pain protocol, this is what his owner sent me. So you can see he's rolling around on his back, kicking the couch. You can see his tail wagging. And his dad was just delighted. And he was just all, yeah, what do you do? That's what I asked him too. What are you doing? So he was just having the time of his life. We didn't get a whole lot of time out of him. He actually was having a really difficult time. We asked Dr. Bedford, I don't know if you guys know Dr. Holly Bedford. She is a veterinary acupuncturist who does house calls, and she works with AccuVets. I just love her. So I did the kind of Western medicine medications and supplements for this dog, and then she came and gave him acupuncture. And I remember his mom was worried that he wasn't going to do well with acupuncture, and you know, what if he tries to get away and one of the needles goes in too deep? And they sent me a video. He slept through the entire thing, like snoring, sleeping. She had him there and she was needling him, and he was just out like a light. So it was great. And so she does acupuncture, herbs, food therapy, and is wonderful. So that's another option for pain. So I do that. I think laser therapy is fantastic. A lot of your vets have lasers. That is wonderful for arthritis. So there are things, and the AccuVets, they work on everybody. You know, if it's cancer patients or arthritis, it's not just for pain. They address whole body just like a regular veterinarian would do. So I really love them, and they're at accuvets.com. So this is the most common thing I see with kitties, and that is nausea and not eating. And that can be caused by a variety of things. Usually some sort of gastrointestinal disease, whether it's inflammation or cancer. We just have a hard time getting these guys to eat. And one of the things that I found out through talking to people about their research is that as they age, especially kitties with kidney disease, their sense of smell and their sense of taste changes. So things that appeal to younger cats or even older cats without kidney disease will not appeal to a kitty who has kidney failure. And so some of the prescription pet food companies, Hill's has their new Eat technology where they basically figured out what herbs and spices these cats are attracted to and put them in the food, and also made it so that the food had enough dense calories that if they only ate, I think it's 70% of the food, they still got their daily necessary calories and their necessary protein. So whether it's special diets, whether it's adding things to a regular diet to increase their palate, putting them on nausea medication, putting them on appetite stimulants. There are all kinds of things that we can do to make them feel better. My own kitty had multiple problems. She was just a little kitty train wreck. And I put a feeding tube in her because she was so happy and so good and running around and jumping on things. I just couldn't get enough food into her, and it became such an argument, and she didn't want her medications. And so I was at the point where I had to decide whether I was going to euthanize her or whether we were going to put a tube in her. And I was really reluctant. I was a typical mom. I was like, oh, I don't know if I want to do this to her. And she did great. She had that feeding tube for about 8 months, and I wish I had done it sooner because I think I could have given her a whole lot more time. But all her medicines, all her fluids, everything went into the food. She gained weight. Her coat got prettier, and she was still sassy as all get out, running around beating up on her housemates. So even things like that. Now, I don't put feeding tubes in, but I can certainly, we can have that done at your vet. But I like to think outside the box and what can make them comfortable. What can we do to really improve their quality of life and yours? Because it was really hard on me that she wouldn't eat. It was driving me crazy. And I'd give her an appetite stimulant, and then she would be just obnoxious, and then she still wouldn't eat enough to sustain herself. So this was the easiest thing for both of us, and in retrospect, I wish I had done it sooner. So there's lots of things we can do for this. Baby food for pets, and sometimes putting their food in a blender or adding enzymes to it to kind of digest it a little bit for them. Addressing any pain in their mouth, because a lot of older animals, they have bad dental disease, and if we can get their teeth taken care of and get a dentistry done, I think that's wonderful. Some patients we can't, and for those I usually prescribe pain medication so that we can make their mouth more comfortable. I see a lot of cancer patients. Unfortunately, I see most of them for euthanasia. I don't see a lot of them for hospice care, mostly because people don't know that this is available. But we have the typical things that are recommended for cancer. Some of them can have surgery and chemotherapy and radiation. I actually have a hospice patient now who's had chemotherapy, and he's at his 10-month out from chemo and has only started having problems in the last 2 weeks. His owner said they never would have known that he had chemo because he's just been so good. And a lot of people are afraid of chemo because obviously we've seen all the movies where the chemo is so horrible and you're throwing up everywhere. We can't do that to pets because we can't explain to them, oh, you're going to be really sick, but you're going to feel better. We have to make sure that we keep them eating and drinking the whole way through. And it's not for everyone, and if it's not for you, that's fine. But certainly anytime that I diagnose a patient with cancer, I recommend going to talk to an oncologist. The consultation, is worthwhile. It doesn't mean that you have to treat, but it's really good to find out what your options are. And I don't think anybody knows as well as an oncologist, what kind of odds they have. So if you can go in and they say, well, hey, I've treated this many patients with this protocol and this is how much time we get, then you're making a more informed decision. So I really do recommend checking that out with them just to make sure, that you've exhausted the options that you want. We can do palliative care. So if they have a cancer that's not as aggressive, that we can just keep them comfortable. I'm happy with that. Hospice care, if they're toward the end, if we expect that we're going to lose them in the next couple of months. And then euthanasia if we need to. But this is, this to me is one of the scariest diagnoses in people and in pets. You hear the C word and you get all upset. But there's a lot that can be done, and a lot of my patients say, oh, well, we had heard that he was only going to have 2 or 3 weeks and it's been 6 months. Things like that do happen. So if you've got a bad prognosis but your pet doesn't seem to be doing that badly, some hospice care is probably worthwhile because we may be able to get some more quality time with them. Even if you're electing not to treat them, we can at least keep them comfortable. And I just want to talk just a tiny bit, because this is another word that scares everybody so badly. And I'm a big fan of tripods. I've had a tripod kitty myself that I rescued when I was first out of vet school, and they're awesome. You know, they're just great. And so what I want to remind people is, if, especially with dogs with that nasty bone cancer, that osteosarcoma that they get, you know, amputation can be curative, but people say, oh, you know, I don't want to do that to him. And certainly in an older pet, you know, if they have 3 other bad legs, you don't want to take one away, because then, you know, you're just going to make the other ones worse. But if they're in relatively good shape and they think that they can cure them with an amputation, it is well worth it. It takes a little bit of getting used to, but what we have to remember is that pets don't have that mental issue with amputation like we do. You know, oh, we're losing a part of our body, we're going to be less attractive. They don't care about any of that. Most of them, when, you know, I used to do quite a few amputations at the shelter, we'd have pets come in with, you know, broken legs or you know, problems that we just couldn't fix. And I did a lot of them, and these are a couple of my patients. And both of these dogs, this was the morning after. Mm-hmm. And I mean, this almost looks healed. This was a puppy, so she did beautifully. And this dog was a little bit older. So I don't want you to be afraid of that word or to hear it and go, absolutely not. You know, think it through and talk to your veterinarian, have a consultation, because we've had these tripods that it actually cures them of their cancer. It's not always, but it's worth checking out if you can have your friend for longer. And they do okay. You know, the worst that I've seen is I did have a cat that tried to walk backwards for a while because he really wasn't sure what was going on. So he hopped around backwards, and then he went forwards and went, oh, that's how you do it. And that was it. You know, it took maybe 10 minutes for him to be okay. It's more upsetting for us, I think, than it is for them. But if you're, you know, willing to work with them and do some rehab with them and be patient with them and give them the support they need, they usually do pretty well. So, you know, if that's a choice that you're facing, please feel free to give me a call. I'm happy to talk to you about it. But this little guy she was just so adorable. And this one, like I said, this was the morning after, and they let us put a sweater on, you know, and with a big incision, and they were just like, let's go outside. It was really cold out, so everybody thought, oh, you know, he's naked on one side. She's naked. She needs a sweater, and so she wore a sweater over her little stump. You know, with Kelly and Steve's dog Nikki, you know, I did the ear amputations for them. Sometimes it's just a toe that, you know, a toe or a few toes that need to be taken off. You know, ears. The other one that gets people really badly is eyes, you know, to do enucleations. I actually have a good friend who I did hospice and euthanasia at home for her dog. She has a dog who has no eyes. She was fostering this dog, and this dog is so happy, gets around, runs around. So if your vet says, you know, there's something really bad going on here, and I think that eye needs to come out, be worried about it, because, you know, you're a pet parent and you're going to be worried. But don't let that decide you, oh no, I could never do that. Because honestly, whatever you're taking off is probably more painful than the surgery is going to be. And disease pain is worse than healing pain. So a lot of these guys, you know, you take off that leg with the nasty bone cancer, and it's uncomfortable, but it's so much better than what they were feeling before. So that, you know, makes them feel better and makes them get better faster. So a little bit about cognitive dysfunction. I don't know if you guys can see this. This is my dog, Muggle. He crawled into bed, but he only got halfway before he fell asleep. So he had the doggy Alzheimer's, and this is very similar to Alzheimer's in people. Unfortunately, there's not a huge amount that we can do about it. We can't fix it. But caught early enough, and I'm embarrassed to say I didn't catch this early enough. I work from home with my dog, and I just didn't notice. You know, one day I went, God, you sleep all day long, and it just didn't occur to me that, you know, that he was having a problem. But even though I kind of let him get away from me, and it took a long time, or it was there a long time, I found that little things to stimulate his brain. I changed him to a food that's specially designed to support their brains. I would hide his food in puzzles, and he would find the food in the puzzles, and you can get those on Amazon. They're awesome. Or like a Kong toy, you could stuff a Kong toy with food. And I just noticed he stopped sleeping so much. He was more responsive to me. It was just stimulating his brain a little bit because he was doing nothing but sleeping all day. And he improved and did better. For a while there, I would hide the food puzzles because he could get through them so quickly. His business, he was good other than the fact that his brain didn't work. And that was really hard for me to make that decision. And so having support for that is really important. And I had, a good friend who's a veterinarian that I called who kind of talked me through it. Even though I do this for a living, when it's my babies, I'm the mom. So I need somebody to help me too. But there are supplements that help with this. They're fairly new, so we don't know a huge amount about them, but the studies are starting to come out that they do help. The foods, the BD, Science Diet BD and the Purina Bright Minds, I have used both of those and seen differences in my patients. Supplements like SAMe, Denamarin, fatty acids, there's a lot that we can do to support their brain function, but mostly exercise and making them use their heads really helps. So, if you're starting to see this in your pet, if they're having accidents in the house, and we want to check them for urinary tract infections, make sure they're not sick from something. But if we think they're getting confused or they get stuck under furniture or they pace a lot, talk to your veterinarian, because really there are things that we can do to kind of stave that off a little bit. I have a few resources, and I have cards in the back for APLB Day by Day and the Pinellas Animal Foundation. AliveandWellness.org. Sandra Orr is a licensed marriage and family therapist, and she's actually right down the street over here. She has dedicated her practice to pet loss, and I think that's just fantastic. So she is a therapist that will walk you through pet loss if you're having a hard time, and it's okay to have a hard time. There are articles out there talking about how for some people losing a pet is worse than losing a people family member. They're our whole world, and they're the only thing in the world that loves us unconditionally. So it's okay to have a hard time when they pass. So these are some people that you can talk to. APLB does online chat rooms, and I went on there to spy for my clients because I wanted to make sure I was sending them someplace good. So I went and joined one of the pet loss groups, and before I knew it, I was crying about my own cat and sharing stories about her, and I felt better. I didn't even realize I was still upset about her being gone. It was months later. So they're fabulous. I absolutely love them, and the people that attend are so supportive of you because they've been there. So I actually recommend for my hospice clients to start going to these chat groups before they lose their pet. For me, the anticipatory grief, the knowing that losing them is coming, is a lot worse than afterwards. And so having that group, and you already know the people there and you feel comfortable with them, can really help you process all of that grief. But don't let anybody tell you that it's just a dog or it's just a cat. I'm the last person in the world who ever say that to you, because I think they're family. So don't be afraid to seek out help. Every client that I put their pet to sleep, they get a list of all of these people to help out. And it just helps you move through it, I think, a little quicker and with a lot more support, so that you're not feeling alone. Pinellas Animal Foundation is here in town. So they have in-person meetings. And you can go to their webpage and look under programs, and then they have pet loss under there, but they have a counselor that has a support group. And I've heard a lot of good things about it. And Day by Day Pet Support is actually up in Pennsylvania. It's run by a friend of mine, and they have online groups and a 24-hour phone hotline. So somebody will answer the phone to talk to you if you or someone you know is sad about your pet. I have had clients that are suicidal over losing a pet. It's a big deal, so don't minimize it. If you see somebody or if you or somebody you know is having a hard time with this, please get some help. All these references are on my webpage as well, and links to their pages. And then I'll give you a few resources. The IAA, or the IAAHPC, is the International Association for Animal Hospice and Palliative Care. That's who's doing my certification. They have great resources. They have some webinars and things that are helpful. They will also help you find, so if you have a friend, let's say, out of state, who needs a hospice veterinarian, they also have a directory. Do you guys know Dr. Andy Rourke? Are you familiar with that page? Okay, he is hysterical. He's a veterinarian. He also does improv, and he makes these awesome videos. He's got lots of articles on his website. He supports vet professionals and clients. And if you have not seen his Cone of Shame series, it's really corny, but it's really hilarious, and you learn a lot of good stuff. So I write for Andy Rourke's page. He's got about 30 of my articles on his page. Hospice.org is another place that there's lots of good information about end-of-life care for pets. the American Animal Hospital Association. And then this is a new website, The Pet Effect. This is something put on by Zoetis, which is one of our big drug companies for veterinary medicine. And this is all about human-animal bond research. I just went to a lecture on this, and it's fascinating how they will put dogs in an MRI and let them smell their owner's scent, and it lights up their brain like the best reward in the whole wide world. Even better than if you put their housemate dog scent with them. So what they were saying at the lecture was the dogs don't think of us as their pack; they think of us as gods. so these dogs, I mean, it just showed how much they love their owners and how affected they are by them. But the Pet Effect has lots of information about human-animal bond, and the whole field is so fascinating. The research that they're doing, it'll help you keep up. They also have, Zoetis has these two great commercials, one for prescription cat and one for prescription dog. I don't know if you've seen it. I have them on my Helping Hands Facebook page, but they do it like a drug ad, are you feeling down? Do you need prescription dog? And the side effects, and it's awesome. I cry every time I watch it, even though it's supposed to be funny. But anyway, that is something to check out. Certainly my webpage, helpinghandspethospice.com, my Facebook page, which is also Helping Hands Pet Hospice. You can call me, contact me anytime. I'm always happy to talk to people about their elderly pets. This is my passion. You are never bothering or disturbing me. If I can't sit and talk to you, I won't answer the phone. So let me know if there's anything that I can do to help. This is all my contact info, but it's also on the card in the back. And that is it for the official presentation. But we'll do questions. I'm going to turn off Facebook Live because I don't think we can